Welcome to today's edition. My name is Dr. Dickens Lubanga. I'm a consultant pediatrician based in Bungoma. So today we talked about immunization and why it's important for children and even adults to be immunized. And usually vaccination we refer to an action whereby we introduce either alive or a dead part of the disease causing organism into the body so that we are able to make the body to produce antibodies. And once the body produces these antibodies, basically these antibodies are also referred to as memory cells, so that when the disease comes, the body is able to remember that this organism is an organism that I know, and so the body is able to defend itself against that particular organism. And therefore, even if someone was to get the disease, then the disease is not as severe as it will be compared to someone who has not been exposed before to the pathogen. Therefore, vaccination is very important, and vaccination has continues to reduce more than 4 million deaths yearly because of what it is able to do to the body. So, whatever you're saying is that whenever your body gets a disease that it has never suffered from before, therefore, it fails or it does not know how to respond. And that is what makes the disease uh, more lethal and even contributing to death. But when you vaccinate a child or an adult against the specific disease, then the body has a memory and is able to remember it even when it comes later on. So currently we have the Kenya Immunization Expanded Program, which is run by the Ministry of Health of Kenya, that encourages all babies who are born in the Republic of Kenya to be immunized. And usually there is a rota that is followed by mothers when they go to the clinic, when they visit the clinics after delivering their child. So the first time the baby is born, usually they're given oral polio vaccine, and also they're given BCG vaccine. Remember, polio used to be a very bad disease that used to cause lameness in the society, but currently it's almost being kicked out. Ideally, we've not had any case of polio in this country over the last 10 or so years. So we are on an effort to basically kick out polio in the country because of the aggressive vaccination schedule that has been undertaken by the government of Kenya, by UNICEF, and also other bodies that have been keen to ensure that all children receive this vaccine. Now, from that point, we go to 6 weeks. Now, at 6 weeks of birth, usually they're given a single vaccine that has 5 vaccines in it, so which is called as a pentavalent. So this pentavalent tries to prevent all the 5 diseases together, so which includes diseases like tetanus, diseases like diphtheria, diseases like pertussis, and also whooping cough. Remember, these are diseases that used to kill a lot of people by 1900. And so by us giving this vaccine, then you're able to prevent those kind of deaths from those diseases. At 6 weeks also, we also give pneumococcal vaccine. But remember, the pneumococcal vaccine that is given at that time is a polyvalent vaccine that helps to prevent against 10 serotypes of bacteria that commonly affects or influences childhood infections during that period. The same is replicated at 10 weeks. And also at this time, we also give rotavirus vaccine. And remember, we're just from a rotavirus season whereby majority of our children have been suffering from acute diarrhea, vomiting with high-grade fevers. That is the characteristics of rotavirus. So children who are vaccinated, actually, they tend to improve a bit faster compared to those children who have not been vaccinated. I remember these are diseases that used to cause really severe dehydration because of prolonged diarrhea. And also it used to cause so many episodes of rectal prolapse that required us even to insert manually back the rectum because of the prolonged duration of diarrhea that it used to cause. And therefore it used to cause a lot of deaths before. Uh, so from that, so we give that is at 6, 10, and 14 weeks. Then, so the child is not vaccinated again until 6 months. At 6 months is when we give them vitamin A. Vitamin A, remember, it helps us to prevent against night blindness. It's very good for the eyes, so that usually they're able to see well, especially both night, especially night vision. Then we go to 9 months, whereby the Kenya expanded, that's KP, gives measles and rubella vaccine. And these ones usually they tend to prevent against measles and rubella. And usually because measles used to cause a lot of pneumonia before, and it used to result in a lot of childhood deaths. And remember, the under 5 deaths in sub-Saharan Africa remains the highest in the world. Remember, for example, a country like Kenya, while we are losing more than 43 out of 1,000 children below 5 years in Kenya die, compared to the rest of the world, compared to developed countries whereby they lose hardly 1 out of 1,000. And so, as a family, you are guaranteed that even if you have one child, then you are guaranteed that they might actually live to adulthood, compared to us, whereby we tend to lose around 43, which is 43 times more than what the developed world tends to lose. And so, from 9 months, so we go to 1 year, whereby now, at this period now, they're given ABZ, which helps to prevent them against worms, that's intestinal worms. Then from there, we weigh these children, and then at 18 months, we give them a second booster of measles and rubella. But in the private setup, there's a bit of a change, whereby majority of these vaccines are actually differentiated. For example, while the KP1, that's the government one, gives the 5 vaccines at 6, 10, and 14 weeks, in private they give a different one called Hexaxin. So Hexaxin has got six types of vaccines in it. So in terms of injections, so they'll tend to get one less injection compared to the ones that KP gives. And also at 6 months, we also introduce influenza vaccine, which is also called flu vaccine. Remember, majority of the children don't have a good immune system. They are not yet used to the environmental viruses and bacteria. And remember, majority of the flu is caused by viral infections as opposed to bacteria. Ideally, up to 70% of all flu is actually viral. But with time, as the virus continues manifestation, it changes actually to bacterial. And therefore, that's how you see children presenting with tonsillitis, and also eventually leading to severe pneumonia. And also, some of them eventually having heart diseases because of suffering from rheumatic fever. So we give at 6 and 7 weeks flu vaccine, and then at 6 and 7 months. Then at 10 months, we also give a meningococcal vaccine, which prevents against meningitis. Then at 1 year, we also give cholera vaccine, especially in areas that are prone to getting cholera. And also at 15 months, you also repeat the meningococcal vaccine. And once you give that, basically it gives you lifetime protection against meningitis. And then at 18 months, you also give you measles, mumps, and rubella. So that is what's given in private. as opposed to government that only gives measles and rubella. So here we also protect mumps. Remember, mumps causes a bit of swelling on one side of the neck, and so when you're vaccinated against mumps, then basically it really protects these children against the harmful effects of mumps. Remember, also mumps in boys it can also lead to infertility because it also tends to affect. It has testicular effects, and that's why we normally say at least if a child has this, then they should also be managed by a qualified pediatrician so that they're sure about the complications that come around. Now, there are other vaccines that we give as boosters, and that's why you'll see the ministry. Once we have an outbreak, let's say we get a child, let's say in a given location with measles, then the whole area has to be vaccinated. The reason why the ministry is really emphasizing on vaccination is because of the concept called herd immunity, whereby the more the people are vaccinated, the more they protect those who are not actually vaccinated. The few are not vaccinated within the community. And therefore, vaccination basically has helped to increase even a life expectancy. Remember, by the year around 1900, the life expectancy of an average Kenyan was around 25 years. So this improved later, so that by the year 2000, the life expectancy was now in our 50s. Currently, as we speak, our life expectancy is heading somewhere around 70 years. So that tells you, with the modern medicine improvement of the number of doctors that you're having, the number of healthcare workers, and also with more public health awareness, that is intervention aimed at preventing diseases, like correct hand washing habits, correct segregation, and also uh, trying to avoid overcrowding, because all those are conditions that tend to cause more of these diseases. And also, the biggest cause of death and even basically sickness being a lower socioeconomic society, whereby majority of the people are not able to afford either basic food, um, basic hygiene practices, and even just to effectively breastfeed, to breastfeed a child for 6 months, according to the government regulations. Therefore, vaccination is something that has really assisted us as a country, basically, to achieve even the sustainable development goals that tend to look at how our country is doing in terms of it's able to vaccinate its population and also help eventually in preventing deaths. And so, with what the ministry is doing, what the county government is doing, and including some of those tropical neglected diseases that have been there before, but you find that now there are some of them that have actually been forgotten because of the advances that you have had through uh, vaccination and the policies that the government is pushing around to ensure that all children are vaccinated. So, as I finalize, we are basically encouraging all our people, all our mothers, let us embrace vaccination. We know there have been so many people whom we call the anti-vaxxers who are against vaccination. We wonder why, because, like I'm saying previously, people never used to be vaccinated, but they used to die early. They used to die before 5 years. But right now, we are saying that majority of us are now living longer because of the efforts that the government has been trying to do and also other international partners. Therefore, why should people not be vaccinated? It's like taking us back to the 1900s, to the 1800s, when there used to be scourges and outbreaks of diseases that will kill millions and millions of people. You see, a disease like polio, polio can lead to an entire community, everyone. Usually, ideally, it affects their limbs, their lower limbs, and therefore um, they're not able to walk. Now, diseases like TB used to kill so many people at ago, but right now those are diseases that have been prevented, and now people are able to live successfully, even with vaccination, and also there's a very good treatment regimen for those who have contracted TB. because having been vaccinated gives you some exposure, and so you're able to fight a disease better compared to someone who has not been exposed to a given disease. Therefore, we are saying that those people who are against vaccination, we are telling them to reconsider, because vaccine saves lives. Vaccines have been there, and since the establishment, they've been key in terms of preventing deaths. Thank you.